Hi, my name is Mia Pappas. I am an epidemiologist and a director of the Value Institute here at Christiana Care. And I'm going to be talking to you about study design considerations. And I want to thank Dr. Marci Drees and Claudine Jurkovitz for helping put together this PowerPoint presentation. So I'm going to talk a little bit about the role of an epidemiologist in healthcare studies, the hierarchy of research study designs, and then considerations about using study design. So when we think about how we're designing studies, we really want to focus on four important things. One, how do we choose that study population? Who are we studying? How many people? And how do we get those people? So the sample size and sampling plan. How do we actually implement a study, and how do we have fidelity to that study protocol, and think about quality control of the data that I'm collecting, and how do I collect data? How do I design a questionnaire, an interview, a survey? So we're going to talk about those four considerations in the context of study design and doing health research. So first, designing studies, thinking about all of these things, they're really challenging. And I love this slide, this quote from Mason Cooley, which really, states that every path to a new understanding begins in confusion. So hopefully you are super confused, and at the end of this, we'll have some small enlightenment that you will come to. So let's start with why we do research. So, we do research because someone is sick. Right? Something happens, and we want to understand how we can either prevent that person from being sick or treat that sickness so someone gets it better, right? We have a way of classifying disease, but maybe we have no effective treatment, so you have a poor prognosis. And so then you realize, there's research that says, I can do a study that says that in this type of person with this type of disease, I can treat them successfully with large doses of chocolate. And so then we have a way of treating that says, let's eat lots of chocolate. And so research is cyclical, right? And everyone loves this study because we get to eat lots of chocolate. But then we want to maybe even extend and say, all right, well, who should eat lots of chocolate, and how much chocolate, and what are the outcomes, long-term outcomes for eating lots of chocolate? And so research is a continual process that we go through to discover new treatments, and then to understand who those treatments work for. Research really is that inquiry. So you come at it with a really inquisitive mind, and you understand that there is a systematic way of investigating, of answering that question, right? And so a lot of epidemiology is understanding what is that systematic investigation that allows us to say that something is causal, right? And research needs to be purposeful. So we have this inquiry, this question, we have a systematic way of exploring that question, and we have a purpose for why we are doing what we are doing. So here's kind of the research process, and a lot of research and that systematic investigation is kind of like a recipe, right, where we're following steps to get us to that perfect cupcake. And we know that if we put in too much baking soda or put salt instead of sugar, that cupcake is not going to taste as good, right? So we know with research that the steps that we take are really important in order to give us research that we have a belief in, right? That we have faith or confidence in the answer at the end. Okay? And those steps are 5 major steps. So how do we identify our study question? How do we think about our study approach? How do we design the right study and collect the right data? Then how do we analyze that data? So this is where epidemiology and statistics, so that statistical inquiry, how do we analyze data, interpret data, and then report our findings so that they're understandable? And so we'll take a step back and think, okay, what role does epidemiology play in this whole thing of research and the research process, right? If you think about it, Epi is sort of the science of, it's the science of public health research. It's the science of clinical research investigation. It's what brings that scientific structure around doing research, right? It's a way of studying the 3Ds, right? The distribution of disease in populations, right? So we don't know how disease is distributed. We don't know what our major challenges are, right? And then the determinants. So why do we see a particular distribution? What is the determinant? What are the risk factors of disease? And it's not just studying for studying's sake, but it really is then to enable the prevention and control of health problems. And so how do we disseminate that information so that we are then preventing disease or controlling disease? And so if you think about the research process, that understanding the distribution, understanding risk factors and determinants, and controlling disease and leading to programs that control disease, fit, right, across all of these steps, right? So an epidemiologist helps with identifying the study question, because we don't know the distribution of disease. How do we know what questions we should ask, what's important to a population? And then figuring out how we understand the determinants of disease impact how we are going to actually approach that study, design that study, analyze those data, and report findings so that they can be impactful. The research is really like the house, and epidemiology provides the foundation for that house. And sometimes quite a large foundation is needed. This slide is sort of one of my favorites, sort of a view of the value of epidemiology. So we look at the right, this says it's today's random medical news, and it's just spin the board, right? Here he is. According to a report released today, coffee can cause depression in twins, right? If you think about, here's the determinant of disease, here's the disease we're interested in, here's the population. And it feels sometimes when we read about research, when we read about all of the studies that are being done, that we're just bombarded with random medical news. And, part of the reason being that we've created a scientific community that is exploring and wanting to know, like, what's the latest? What's the latest and greatest? How can I prevent depression? Oh, it's coffee. Oh, maybe now it's not coffee. Maybe it's smoking. We have really complex reasons why disease happens, and we're trying to kind of simplify. And in that simplification, we get a lot of these one-off risk factors for disease process things that happen. And so we as scientists and we as engaging with the community, who's the consumer of this information, need to really think about how we're communicating epidemiology and epidemiologic science. Because there is an art to thinking about this systematic scientific investigation. Right? So, a lot of the methods that we use in epidemiology really came out of the smoking and lung cancer discussions in the 1960s, and the Surgeon General's report in 1964 that came out with saying, that tobacco is a cause of lung cancer, right? And in that, there's a lot of then discussion around this word cause. Right? Thinking about what it needs to be a cause. And statistics alone is what the Surgeon General said. Statistical methods alone cannot establish proof of a causal relationship in an association. Right? That's that causality is not necessarily implied from correlation. Right? You have an association, it doesn't mean it's causal. If I have an umbrella with me and then it rains, it doesn't mean my umbrella caused rain. Right? It just means that when there's rain, people are more likely to have umbrellas, right? That proof of causality. But thinking about cause, like causal significance of an association, is really a matter of judgment. And it brings in societal judgment and scientific judgment. And it goes beyond any statistical probability. If you think about terminology like any p-value of less than 0.05, and any sort of statistical probability, that there's this larger way of thinking in a systematic way about what it means to be cause that brings in societal and scientific value. And so, what we have is kind of a modification of this epidemiologic lens. So think about like a telescope. Through a telescope, we can view what's out there beyond what we can view with the naked eye, right? And through our epidemiologic lens, we see some observed effect, right? We see this statistical association, and we can then view, right, what's out there beyond just my one statistical study, right? Because what I want to see is that true causal effect. But it's really difficult to see that effect with my one study. Like, it's really difficult to, see planets that are very far away with my naked eye, but I can build a telescope that helps me see that planet. So I can build, right, an epidemiologic telescope that helps me look at that causal effect from the observed data that I see. And I build that, right, through three lenses. Through a lens that looks at information, and sometimes we think about bias, like, so is the information I'm collecting, is that distorting my view, right? So is that a bias in the information that I have? How about selection? The way I've selected my population, who remains in my study, is that way that I've selected my population, is that biasing or distorting my view? And then I think about something like confounding. What are the other reasons why I might see this association? And through those three really just important pieces, information, selection, and confounding, I can think about whether or not the observed effect, how much faith I have or belief I have or confidence I have that that observed effect is close to that causal effect. Because we want to build programs where we have evidence of cause, right? Because then we are more likely to actually reduce the disease or improve the outcome that I'm interested in. And Epi works, this whole process sort of works through a process of surveillance, right? So we talk a lot about data, and we need data, data-driven approaches, data, right? And what data does for us, right? It helps us describe things. It helps us look at what is going on in a population. It helps with surveillance, surveying the landscape, right? We are doing surveillance. We're surveying the landscape of health and health outcomes, right, of our population. We're describing things. And that is the first step in any kind of investigation, is to have that survey data, right? That surveillance of information, to have that data. And this data is now at our fingertips in a way that it has never been before. And that data then allows us to generate hypotheses, right? So think about hypothesis generation. And then we can superimpose on those hypotheses a way of testing those hypotheses. And those are analytic studies. There's lots of different types of analytic studies to test hypotheses. And then once we think, oh my gosh, here's a hypothesis that I've tested, I think this might work, let's try to bring this into practice and develop an intervention. And I don't want to just develop the intervention, I want to make sure that I'm testing the intervention, I'm evaluating whatever it is I'm doing. And those are called evaluation studies. And then it comes back around to surveillance, right? So I go from describing to generating hypotheses, to testing those hypotheses, to developing these interventions, to testing the interventions, and then I'm back again with surveillance. Like, did it actually, what some people call change the needle? Did it actually change the needle? Did I move the description of disease in my population? Did I improve anything through this process? And there's different sort of quality of evidence, right? Different ways that we can do studies, and those are called study designs. And each one comes with their pros and cons. And there's gold standard because they're thought to be more rigorous. And what it means with rigorous is it just means that the way you conduct this study gives you more confidence that what you're seeing, right, that observed effect, what you're seeing is more likely to be causal, right? So it's minimizing bias, and that's what rigor sort of means when you see hierarchicals of study design. So I'm going to give you my favorite kind of tau of epidemiology. So just kind of thinking about what an epidemiologist does and why epi is so critical to this whole research process is, some people think, okay, epidemiologists, they just count things, right? You're just counting stuff. And why is that important to just count stuff and have data, right? But we do count things. And so counting things is really important. Like knowing the number of people with diabetes in my community is super important, right? But I don't just count things, right? Because the trick is not just counting them, right? The trick is that we need to figure out who and what to count. Right? The devil's in the details, as they say, right? So really figuring out who and what to count, where to find the things to count. Once you figured out what to count, when to count them, critically important, how to count them, and then how to organize what you've counted in a way to help you reveal patterns, right? To do that exploration. And then finally trying to figure out then what those counts mean. And so in any research endeavor, always ask an epidemiologist. Okay, so let's think about the components of the research process. And here there's sort of 4 components. Sorry for the typo. They all say 1. But those components that we talked about from the beginning, really, so now you know what epidemiology is, right? The foundation of epidemiology, that sort of scientific process. And now we're going to talk about the 4 components of the research process. So choosing study population, sample size, study implementation, and designing questionnaires. And we're going to go through some examples that have been used previously within the Delaware Center for Delaware Center for Clinical and Translational Research. So this was a study by Dr. White looking at long-active reversible contraceptive. So she had an objective that was to assess parental preferences about LARCs. So LARCs can be implanted in adolescents, yet they were concerned about parental preference. So they did a survey, they targeted 100 people, and their study population were Delaware parents. There was a second study looking at the baseline health of people in North Charleston before new terminal operations. And so they had validated survey, they had 42 people in each of 7 neighborhoods, and they knew their study population. So this is the basics on how we get started with exploration. There was a study looking at inclusion of individuals in fitness programs. So very easy, like I want to study inclusion of people in a fitness program, but what's your real objective, right? So their objective then laid out they wanted to look at the effectiveness of a type of fitness program in young adults with intellectual disabilities with and without video support, right? And so they successfully completed video recording exercise. They targeted 6 individuals, right? So studies don't have to be huge. They can be exploratory with a few people. And they knew their study population was young adults with intellectual disability. Allison Carpin was another project that looked at healthy food. And so these are just examples of the process when thinking about and working with an epidemiologist that you would go through is really thinking hard about what are my objectives, what is it that I want to measure, and what is my study population. Because depending on these questions, remember that foundation, everything else, right, will be built around this particular beginning, right? Objective, measurement, and study population. So I'm just going to scroll through some of these examples and stop there to see if anybody has any questions to discuss them or call your local epidemiologist. Thank you.